Social work education needs service user and carer participation at the heart of it. I think service users and carers are what social work is all about, and students need to understand that right from the beginning.
At the moment we talk a lot about personalisation, we talk a lot about nothing about us without us. I think we have to walk the talk around that. So I think there's a tremendous potential for more quality engagement with service users and people with caring responsibilities.
In August 2012, the Health and Care Professions Council took over as the regulator of social workers in England. Our commitment is to setting a standard which will ask all providers to involve users and carers in the delivery and design of education.
The research that I was involved in showed that in 2008-09, across the country, there was 6,000 service users and carers involved in the social work degree, and almost 1,000 involved in post-qualifying programmes. It's mandatory that service users and carers are involved in social work education across all the 83 colleges.
I was a practice assessor of social work students up to last year, and I could tell which students had been with service users. You could see that they're more of an understanding.
Service users and carers show the social work students what it's really like to be in the social care system.
No amount of academic learning can give you the same degree of understanding and insights that having been there yourself with mental distress of one kind or another can give, and this is what we bring. It's like gold dust, to be honest.
It gives a real world understanding of what the reality is out there. It keeps my social work values at the forefront of my teaching and research, because actually that's who it's about.
I think it's about realising the reality of it, but also the responsibility. And I think the third R that I would want to say is also about the bit about respect, is respecting people's experiences. There isn't just one experience.
Social workers have to work with very difficult problems of child sexual abuse, of violence, of neglect, of people who've got very difficult times in their mental health, who basically want some support. Being able to get an understanding of those kind of issues by hearing about it firsthand from people who've been there as service users is so helpful.
It sort of takes the sting away from the trauma. If I can explain to the next generation how it is, that it's not frightening, that it really improves clients' lives, then something good's come out of it.
The things that I share from the scenario are that from the age of 9, I went through the grooming process to be groomed and exploited for the purpose of prostitution.
I'll always remember lectures that we've had. Everybody always says that it brings it home. Everything that you've learned, it brings it together, really.
We all learn actually better through real life experience and being able to make a connection with the reality. And particularly for social work, people are interested in working with people and hearing about people's kind of perceptions and about being on the receiving end of a service.
Everybody knows him the best.
It can offer an actual script for actually working with students in a much more kind of proactive way.
When I applied for the course, I came for interview. So during the interview, service users and carers played major roles. After enrolling on the course, I've met different service users and carers on the training. So they are, in short, part and parcel of this whole process of social work training.
Seeing something firsthand really makes you understand it more, and being able to ask questions is such a way to learn.
The main focus of social work is helping clients and improving their lives. And I think if you don't include them in the course, you're not getting that perspective.
Having participation makes all of the things that we learn come alive.
It's absolutely invaluable to be able to listen, and their involvement is absolutely paramount.